So data collection is an area where the PTA, you are providing or gathering information that will provide your supervising physical therapists and other healthcare providers important information on how your patient responds to mobilization. Mobilization specifically, we're talking about moving, whether that is moving about in bed, moving in regards to transfers, or doing or being involved in ambulation activities. You are on the front line. You are spending more time with the patient one-on-one than most other healthcare providers. So knowing these key terms and be able to describe these terms in your chart and charting is really important. Knowing, for example, that diaphoresis means increased sweating is really important. Knowing what cyanosis is, that is a loss of color as opposed to redness. There are some standard tests and measures that the book talks about that are important and that you can use to gather data. If your patient is expressing angina, you can use that 1 to 4 scale of self-rating, 4 being the highest, 1 being the lowest, and dyspnea scale. This is how much a person can talk and how many times they're having to grasp for air during a short conversation. The textbook talks a bit about the dyspnea scale, assessment of ventilation and perfusion. How many times does that person have to talk during or breathe while trying to express words? And then you're familiar with the rate of perceived exertion, and this is just a really important tool to use. For example, when someone is on beta blockers when assessing heart rate, is this no longer going to give you any indication on how hard that person is working because of the effect of beta blockers on heart rate. The objective test and measures, you know the basic vital signs from earlier in this term, but also just to get the actual distance. How far is that person walking, for example? How long does it take that person to walk 10 feet, 15 feet, 50 feet, 100 feet? For some, it'll be timing them during 6 minutes. How many feet can they walk in 6 minutes? How frequent can they be on a walking program? Or how many transfers can they do? Or how many reps of exercise of a specific loading activity on the joints activity can they do? And what is their level of assist? Are they contact guard assist, or are they, in some cases, min assist? So as we kind of move on to this, further on to the chapter, describing specifically deconditioning is also important. That is the end of this chapter, is answering those following questions. I am going to bounce back a little bit and just go back to the actual heart itself. Knowing these heart conditions is really important, and being able to adjust your treatments based on patient presentation and how these different health conditions and impairments are affecting their ability to tolerate exercise or activity. So, really knowing that these specific terms, such as, what is atrial fibrillation? If you're checking someone's heart rate and it's kind of bouncing all over the place, that would be an atrial or arrhythmia. There is unsteady rhythm of the heart. You're not diagnosing, but there is a rhythmic pattern to heart rate, for example. Then knowing the difference between stable angina, which isn't normal. It doesn't. When I say stable, or the stable is defined, it doesn't mean it's normal, but that activity causes chest pain, versus an unstable angina where a person has chest pain at rest. And we have these nice little links that will help further explore some of these terms to make them more real for you. And I think this hypertension tutorial is quite good. Know that especially for those of you that have been out of practice for a little while, or maybe you have been in practice, but maybe you didn't know that the hypertension guidelines changed 3 years ago in 2017. And what used to be 150/90 for hypertension is now 130/80 for stage 1, and 140/90 is now classified as stage 2. So people may be coming in saying they're hypertensive, and you're checking your blood pressure, and you think, well, that's not hypertension. You're not 150/90, but that's what they're sharing with you is the new norms for hypertension. So that's really important, and it could be an opportunity for you to educate some seasoned therapists about the updates and guidelines. And these are different procedures that are done to the heart. You explored these a bit in PTA 100, so this is worth revisiting. We have links there to help you. I'm bringing out Pablo Arulo's book. It could help you as well. And then I earlier talked about our role of data collection as PTAs.